Hi, I am the educational consultant at Advanced Nurses at ACD4N, and this is an introduction to the course Nursing Data Analytics and Risk Adjustment. This course was actually introduced last year at the same time. I'm just revisiting the course for nurses who are interested in joining the new class. Now, what is risk adjustment? What are ICD 10 codes? We'll look at the structure of ICD 10 codes. We'll define risk adjustment for you, and we'll also help you if you're interested in becoming a certified risk adjustment coder, or maybe if you're interested in any other coding certifications that require in-depth knowledge of ICD-10 codes, this course will help you. Also, we will be looking at the roles, responsibilities, and fundamental competence of nurses as data analysts or nurses data analysts. And we'll also explore training for stakeholder management and presentation skills for nurses. If you go to www.acd4n.com, you'll be able to click onto the course. You can purchase the course. You can also click onto View More, which is this amber color button at the bottom right hand of the screen, and you'll be able to therefore select the course and further breakdown of the course content. And so this course is broken down into 3 sections, each section focusing on chronic conditions that risk adjust. And again, what is risk adjustment? We'll go into that. We'll go into hierarchical condition categories and break that down as well. We'll talk about that in some slides to come here in this presentation as well. And so by the end of the course, you will design program, and this program is going to be based on the data that's provided within the data set about this specific patient cohort. And through data exploration, we will design a program sensitive specifically to the needs of the patients within our patient cohort. And this is the data set here. So as you can see, this data set, we have data sets on patients, budget, providers, students, and instructors. And so we'll also look at hierarchical condition categories. So essentially, hierarchical condition categories is really just like a cluster or grouping of conditions, but they're scaled out by severity. So for example, if an ICD-10 code maps to an HCC, such as diabetes, the diabetes, as you can see here, diabetes HCC 17, HCC 18, and HCC 19 are all different types of different severity levels of diabetes. So for example, diabetes 17 is the most severe because it has an acute complications. What's highlighted here in the red is HCC 18, diabetes with a chronic complication. So diabetes ketoacidosis would be an acute complication of diabetes, where diabetes with, let's say, retinopathy would be like a chronic condition with diabetes. And so looking at the coefficient here, you see that the coefficients here, HCC 18 diabetes with a complication for this 66-year-old patient who's community dwelling, they're partial Medicaid eligible, they aged into Medicare, not by disability, but because of their age. And so there's a relative factor value of 0.348. And essentially, this table, this HCC table, is updated year after year, and it is used to really kind of find out how sick is this patient, like it on an individual level. How sick is this patient, and what does it cost? What is the true cost of care based on the severity of that patient's conditions? So, this is really why it's so important that every symptom and sign we pick up from our patients is captured in our documentation so that the providers and the physicians that see these patients, they're able to write plans of care and clearly write out the diagnostic statement that coders use to code the conditions and diagnosis, but also that we have care that's specific to these conditions, right? So, if a patient has diabetes with complication, what are we doing about that complication? And have we wrote out in their diagnostic statement, hey, this patient has diabetes and they also have retinopathy, so that coder can say, you know what, diabetic retinopathy, that's what this patient has, and we expect to see care to take care of that condition. We're also going to be looking at the RAF score, HCCs, and diagnosis codes. So we'll be looking at the diagnosis codes and the tables. Like this is exactly the tables you'd be provided in the course. You would use this to guide you in the program design and the exercises that you will be using to calculate the RAF score. Okay, again, we'll be looking at ICD 10 structure and the actual code breakdown. Okay. And so again, going back to the hierarchical condition categories, HCCs, looking at health data and the financial impact, this is a good exercise. Here, you'll see similar exercises in the course, and you will complete them yourself, actually, okay? So we have a 74-year-old female patient, community dwelling, full Medicaid eligible, and we're just looking at all the coefficients. As you can see, there's a coefficient for demographics, and then there's a coefficient here for each of the conditions that meet, playing on that word meet, MEAT, the criteria for risk adjustment. And that criteria really means meet that phrase that we commonly use in risk adjustment, which is monitor, evaluate, assess, and treat. So are these conditions being monitored within this year, evaluated within a year, assessed or addressed within the year, or was there therapies or treatments for that condition? So each condition, year over year, have to be captured by the physician or the provider, the primary care provider, so that those conditions can be calculated into the RAF score. So if we have one year where we pick up diabetes, but the next year we don't pick up diabetes, it won't be factored into predicting the cost of care for that patient, simply put. There's also an added disease interaction. As you can see, CHF and COPD and CHF and diabetes, they have a disease interaction. When those two conditions are present and captured within a calendar year for a patient, in the following year, which is what risk adjustment really is about, perspective, right? So there's prediction that in the year to come, this patient is going to need this amount of care. So this RAF score is really a number used that's multiplied by the base score, by the base amount, which is a dollar amount. And that dollar amount, along with the RAF scores, multiplied together to get the per member per month rate for each patient. And then for an entire year, we multiply that same number by 12, and we get to see how much this patient costs for an entire year. So health insurance, health plans, essentially, they use this information to predict the cost of care. So if you're a risk adjustment coder, what you're looking for is that all of these conditions year over year have been captured in that member's chart. So you could have a visit in January that talked about the diabetes. You could have a visit in May that talked about the CHF, and then one in November that talked about the COPD. But as long as it's been captured within that calendar year, it can be calculated within that RAF score. And so it's important that every single visit, the provider is making sure that we have chronic conditions that we are documenting on, that the provider is ensuring that they're treating and addressing, so that these conditions can show the true severity of illness and capture a clear picture of the type of care and services that this patient needs. And so as you move through the course, you'll be given a map to kind of help guide you. So as you can see, we start off at the introduction to the course and section 1, and we end at the evaluation of proposal with feedback. So your proposal for your program that you're going to design, you're going to be given case studies for each of the exploratory data analysis projects, and you're going to, as you work through these projects, you're going to move from one stage and one phase to the next. You will know the progress you're making. You'll be able to reach out to me throughout the course. I found that students really respond well to having feedback really early on and consistent. So that is the reason why I'm going to make myself available to you as you move through the course. So thank you so much. And I hope that you make the decision to explore this course as an option if you're thinking about moving away from the bedside, or if you really love working at the bedside, but you really just want to upscale. So please don't hesitate to reach out to me. You can reach out to me at www.acd4n.com. You can, on my contact page, you can also send an email to advancednurses@acd4n.com. We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com, or visit our websites www.advancednurses.info or www.acd4n.com.